Right, so I've heard about the operation and you described that in very clear terms. You had the two surgeons operate on you and you were discharged from hospital quite quickly as it happens, as is common in the NHS these days. But there's a big hurdle to overcome then, which is trying to find your feet again. And for you, there was also the issue of the stoma care, wasn't there?
There was indeed.
So
yes.
what was the effect on your body and how you were going to cope at that point?
Well, the nurses on the ward initially were changing it for me, and within a day or so, when I was able, with their guidance and supervision, to go, when I got up and had a wash, I would change it myself there. And they would sort of make sure I'd done it right, sort of thing, which, to be fair, isn't very difficult. I think one of the main things is to make sure that you have everything to hand before you start, because the soil bag needs to go in a disposal bag, but it's not much point in going around looking for that when you've already detached it from your body. But I think, so it's stressed upon me there's about 5 things you need: swabs, adhesive remover. You need them all to hand before you do it. And also within about 48 hours, a security care nurse who works in tandem, I believe, with the National Health. So she is a nurse, or certainly wears a uniform and is there with their approval. And they advise you and teach you a bit more. And she explains that one of the vital things is to ensure that you have adequate supplies at all times of these 5 or so items, and that they didn't have to, they could supply them to me, so I wouldn't have to chase about rounding them up or worry. And also that they offered a laser cutting service, because initially you have to sort of measure the size of your stoma, and with a fairly crude card ready reckoner, and you cut them with a pair of scissors. Well, obviously, depending on your accuracy and dexterity, is how good a fit they are. Whereas, once it's settled down, they size it, and thereafter they will be pre-cut to your personal requirements and delivered to your door. So there didn't seem to be much of an argument about not availing myself of their facilities.
Now, some people will be new to this whole area. Maybe they've just received a stoma and they're not sure what they can do and what they can't do. Were there any restrictions, first of all, on your lifestyle as a result of that? Were you advised to make any changes?
Well, initially, since it is a wound that goes through the stomach wall, I was advised not to drive for about 6 weeks. And when you do, to sort of do an imaginary emergency stop, because I think that is the main thing, that you may not be able to move your leg and you're quickly in an emergency, and if you do a sort of trial run, at least, and you experience pain, well, perhaps I better leave it a bit longer.
And any other restrictions, for example, going out, socialising, eating meat?
No, it was explained to me that everyone's a little bit different, and certain things would make the stoma more active, and that I really would have to learn that to myself. But there's a few obvious guidelines like greens, onions, that are pretty common to everybody. But it was really a trial and error basis, and to eat not big meals straight away, but little and often, I think, is a cliche, really.
Yeah. Now, everyone's afraid of having an accident outside and things getting out of control. Can you make any comment on that? How likely is it? Did you have any problems along those lines?
It is possible, and I have, unfortunately, been in that embarrassing situation. It's mostly avoidable with a bit of forethought. What I often do, if I've got an appointment in the morning, I get up rather uncomfortably early because I've found the stoma active during the night, get up, change, but I've found from personal experience that a second change is necessary fairly soon afterwards, But thereafter, the whole thing settles down. So I found that if I just going to do the one change and fly through the door, I would probably be looking at another one sooner. So that while it's not an exact science, that's one thing you can do to help yourself. And the other is, if you are going to go for a curry or a pint, do it on a day when you're not going to do much the next day, because I think I've learned that you might as well have what's not denied you, but realise that not a price to pay, but a consequence.
Yes. What about going out in general? Does it affect, in your opinion, confidence going out?
Yes, I think so, because most people who know you are aware of what you've been through, and you think, are they looking to try and detect it? In actual fact, there isn't a lot to detect if you use your common sense and wear loose-fitting clothes and use your common sense to. But I probably my own worst enemy. I developed this nervous habit of touching it for no good reason.
Yes.
Which is kind of drawing people's attention to it anyway.
Yeah. Did you ever find anybody made any comments that were hurtful or uncomplimentary?
No, I did not. Not in my earshot anyway.
No. What about in terms of cancer in general? How did you find the reaction of friends, acquaintances in general? Not necessarily about the bowel cancer or the stoma, but in general, the fact that you'd been ill.
Well, they were pretty supportive, and I was visited by both family and friends in hospital. And importantly, I think, when I was discharged, they took the trouble to come round, which was reassuring.
Yeah.
I mean, obviously, I was probably in my dressing gown, and I couldn't hide what was what, and I did feel a bit tired and a bit weak. But I wasn't, being their close friends, I wasn't ashamed or uneasy about that. As regards going out, as I say, it's just probably irrationally, overly aware, but I think you can build it up too much, and that you do need a bit of guidance in ways to load the dice in your favour, which I'd have subsequently had, but wasn't forthcoming as quickly as perhaps I would have liked it.